Hello everyone, welcome back. And today we're going to talk about the anatomy of superficial muscles of posterior compartment of forearm. So there are 5 superficial muscles in the posterior compartment of forearm, and these are extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and the Anconeus muscle. So these muscles lie superficially in the posterior compartment of forearm, and these muscles have two things in common. The first thing is that all of these muscles originate through the common extensor tendon from the lateral epicondyle of the humerus. And the second thing that these muscles have in common is that four of these muscles, except the Anconeus muscle, have got their nerve supply from the deep branch of radial nerve, while the Anconeus muscle receives its innervation through its own muscular branch, which arises from the radial nerve. So in this tutorial, we are going to discuss the important anatomical features for each of these muscles. So our first muscle of discussion is the extensor carpi radialis brevis muscle, which is this long, slender, fusiform type of skeletal muscle, and this muscle has got its origin through the common extensor tendon from the lateral epicondyle of the humerus. And after origin, this muscle runs inferiorly along the posterolateral aspect of forearm and forms this flat tendon in the middle of forearm. And this tendon then runs deep to the extensor retinaculum of wrist to insert onto the posterior aspect of base of third metacarpal bone. Compared to its fellow muscle, the extensor carpi radialis longus, which inserts onto the base of second metacarpal bone, as you can see. So now if we discuss the actions performed by the extensor carpi radialis brevis muscle, so as the name of this muscle, the extensor carpi, suggests that this muscle is an extensor of the carpus. So this muscle extends the hand at the wrist joint. Since this muscle runs along the radial aspect of forearm and inserts onto the radial aspect of hand, so this muscle also abducts the hand at the radiocarpal and midcarpal joints. So now let's move on to the second muscle of our discussion, the extensor digitorum muscle. So just like its fellow muscle, the extensor digitorum muscle has got its origin through the common extensor tendon from the lateral epicondyle of the humerus. And after arising from the lateral epicondyle, the fibers of this muscle form a muscle belly which travels inferiorly towards the distal forearm. And at the distal forearm, this muscle belly divides into 4 tendons, and these 4 tendons travel deep to the extensor retinaculum of the wrist, where these 4 tendons travel through the common tendinous sheath of extensor digitorum and extensor indicis muscles. And then along the dorsal aspect of hand, these 4 tendons insert onto the middle and distal phalanges of lateral 4 fingers, that is the index, the middle, the ring and the little fingers. The tendinous insertion of this muscle onto the index and little fingers is not shown in this model, but this muscle also has insertion onto the middle and distal phalanges of these 2 fingers as well. So now if we study a little about the actions performed by this muscle, so it's much obvious from the name of this muscle that this muscle is an extensor of the digits. So simply this muscle extends the digits at the proximal and distal interphalangeal and metacarpophalangeal joints. A second action that is not commonly described is the finger or digit abduction. That is, this muscle abducts the fingers, which means that this muscle moves the fingers away from the middle finger. As this muscle also crosses the wrist joint, so this muscle also plays some role in the wrist extension. Now let's move on to the third muscle of our tutorial, the extensor digiti minimi. So just like its fellow muscles, the extensor digiti minimi muscle originates through the common extensor tendon from the lateral epicondyle of the humerus. And then after origin, the fibers of this muscle travel infero-medially along the posterior aspect of forearm towards the distal forearm, where these fibers form a muscle tendon. And this tendon crosses the wrist to insert onto the extensor expansion of little finger, as you can see. Now let's talk about the actions performed by this muscle. So this muscle performs a single important action, and in order to learn this action, we need to concentrate on the name of this muscle, the extensor digiti minimi. So the word extensor simply means that this muscle is an extensor, and digiti minimi is for the little finger. So simply this muscle extends the little finger at the metacarpophalangeal and interphalangeal joints. So now the fourth muscle of our discussion, the extensor carpi ulnaris. So yet again, just like its fellow muscles, the extensor carpi ulnaris muscle originates through the common extensor tendon from the lateral epicondyle of the humerus. And then after origin, the tendon of origin forms a muscle belly which runs along the whole length of forearm to arrive at the distal forearm. And at the distal forearm, this muscle belly forms a muscle tendon which crosses the wrist and inserts onto the dorsal aspect of base of fifth metacarpal bone. Now let's talk about the actions performed by this muscle. So if we just concentrate a little on the name of this muscle, that is the extensor carpi, it gives us a hint that this muscle is an extensor of the carpus, which means that this muscle extends the hand at the wrist joint. And as this muscle inserts onto the ulnar aspect of hand, so this muscle also has some role in wrist adduction. So now let's talk about the nerve supply of these four muscles which we discussed till now. So as we pointed out earlier that these four muscles which are the extensor carpi radialis brevis, extensor digitorum, extensor digiti minimi, and the extensor carpi ulnaris. These four muscles along with other deep extensors of posterior forearm receive their nerve supply from the deep branch of radial nerve, which is also called the posterior interosseous nerve of forearm. So I am showing you a lateral view of forearm, and I have removed the muscles so you can easily visualize the nerves. So this one is the radial nerve, while this one is the deep branch of radial nerve, which supplies these four muscles along with other deep extensors of forearm. And now the last superficial extensor of forearm, the Anconeus muscle. So this muscle is a bit different from the other superficial extensors in that it is triangular in shape and it has got a short morphology and a short muscle belly. And if we talk about its origin, so it has got its origin from the posterior aspect of the lateral epicondyle of the humerus, just superior to the attachment site of the common extensor tendon. And then after origin, the fibers of this muscle travel infero-medially to insert onto the posterolateral aspect of the olecranon and proximal end of the body of ulna, as you can see. So now if we study the actions performed by the Anconeus muscle, so the function of this muscle is to assist the triceps brachii muscle in forearm extension, at the elbow joint. And now let's discuss the nerve supply of the Anconeus muscle. So, as we pointed out at the beginning of our tutorial, that the Anconeus muscle does not receive its nerve supply from the deep branch of radial nerve. Rather, it gets its nerve supply from a muscular branch of the radial nerve to the Anconeus muscle. So as you can see, this is the radial nerve and it gives off this muscular branch in the middle of arm which supplies the Anconeus muscle as well as the triceps brachii muscle. Now lastly, let's discuss the nerve roots involved in supplying the superficial extensors of forearm. So you need to remember that the anterior rami of 7th and 8th cervical spinal nerves give nerve fibers to all four superficial extensors of forearm except the Anconeus muscle. While the Anconeus muscle has got one more nerve root in addition, which is the anterior rami of 6th cervical spinal nerve. So the Anconeus muscle receives its nerve fibers from the anterior rami of 6th, 7th and 8th cervical spinal nerves. So that's all about the anatomy of superficial extensors of forearm. So if you have any confusion in what we studied, you can ask me in the comment section. Thank you so much.